Commissioner. Our first agenda is the recommendation concerning the Community Redevelopment Agency meeting minutes for July the 2nd, 2020 for your review and approval.
Okay, Chair will
Move.
entertain a motion.
Move technical and public service.
Second.
We have a motion and a second, please vote. Passes 4 in favor with Commissioner.
Grant program funding and lien agreement, and that's the A and B for your approval.
Chair will entertain a motion for A
Move
and
the
B.
items A and B.
Second.
Second, please vote. That passes 4 in favor with 1 off. Claire?
Okay, and the last is the discussion item regarding the recommendation concerning amending the residential rehab grant program. And we have worked on this to try to come up with a proposed version or proposed plan that will minimize gentrification and any house flipping. So this is before you, so I'm looking for your discussion and any kind of guidance in addition to what we've provided.
Mr. Chairman,
Commissioner Bayer.
thank you. Does this represent what you think the discussion previously was? If so, I'd move it. I move it as proposed.
Yeah, that's fine. Have we discussed this, Claire, at all? I don't think I don't know if I've seen this, but
A little bit. We've discussed it a little bit.
that's fine, Commissioner Bayer. I'll entertain the motion.
Second.
Please vote. That passes 5 in favor. Is there anything else, Claire?
That's concluded.
Mr. Chairman, we stand adjourned and turn it over to you.
Super. All right, Board. We can go ahead and call the agenda review to order, August 6, 2020. Please turn your cell phone to the silence vibrator off setting. Before we get into the agenda, Board, we've got two things that I thought it would be prudent to kind of take up. First would be, we've got a guest here this morning, Dr. Ed Ranelli from the University of West Florida. Many of ours friend is here to talk about the university for a few minutes, and then Marie Mott is on Teams if we'd like to have some discussion similar to some of the discussion with Dr. Lanza we've had previously. I think she's prepared to help us with that, and then we move into to our business. But if there's no objection, Dr. Ranelli, good morning, and you've got the floor.
Thank you,
Yes, sir.
Chair Barry. I'm Ed Ranelli, University of West Florida, Associate Vice President for External Affairs, and I'm delighted to be here today. The purpose of our presentation today is to get your endorsement and approval of the University of West Florida's reopening plan. This reopening plan is consistent with the Board of Governors' blueprint for we're compliant with the state recommendations and the CDC recommendations. We also have contacted through the Chamber of Commerce local businesses to indicate that they are in compliance with the CDC regulations so that we can encourage our students to go to frequent those businesses that are indeed compliant with the CDC recommendations. Our purpose here today is to get your endorsement and approval of our reopening plan. It is a comprehensive plan, and we look forward to working with the county and with local businesses to provide for a healthier and safer environment for all our citizens, and specifically at the students and faculty and staff at the University of West Florida.
Super. Board, any feedback or questions for Dr. Ranelli? Commissioner May?
So do we have the plan? It's already been presented. Is it in our backup? It's in our backup. Dr. Renee, thank you for everything. I will have my daughter for the first time attending college and going off, so any support that we can give, we will, and thank you for what you're doing for our students.
We'll
She's
take good
excited.
care of her.
Thank you, we appreciate it. And they have. Administrator Gillies worked with her, and we're very thankful to Dr. Saunders, so we appreciate it.
Thank you. Commissioner Bergosh?
Oh, I'm sorry, no.
Commissioner Underhill?
Thank you, Doctor. I don't actually think it's within I certainly don't think it's within our authority to tell you to approve it, but I certainly respect, I understand and value the active respect that it is for the university to come here in this way. And I will tell you that whatever you can do to, keep the University of West Florida in its proper place in our society here in Escambia County. I mean, you are one of those, shining points of light of this county, and one of the reasons why people come to Escambia County, and then they end up staying and become taxpayers and citizens. So, I am 100% in support of whatever you can do to continue to move that ball forward, continue to educate our young people. Us old people won't be doing this much longer, and we need them. We can't afford for them to lose a year of their education. So, Doctor, thank you for the what is a very considered and fairly thorough plan. And all I can say is execute and Godspeed. Do you? I mean, if the board would entertain, it would require if we require a motion, that's. I'd be more than happy to do so.
Mr. Chairman, I just have one more question for Dr.
Sure.
Renee. What percentage of your courses have been placed online or virtual versus what we traditionally do in brick and mortar?
Well, right now, we anticipate that about 65% of our courses will be online, about 25% will be face-to-face, and another 15% or so will be remote. That's our plan. It is a dynamic plan, so we'll see how it develops. Right now, our enrollment is ahead of what it was prior year at this point in time. Our housing, again, is ahead of schedule, so we look forward to opening with a full complement of students. Although circumstances may change, our plan may be, it's a dynamic plan. We may have to make some adjustments going forward, depending upon circumstances. We look forward to, as mentioned earlier, to continuing our mission of educating the students of this area.
Thanks, Doc. I was hoping you'd say 90% so I could save that room and board and meal plan off of my daughter. But yeah. So, yeah. Thanks, Mr. Chairman.
Thank you. Again, thank you for being here, Dr. Rinaldi, and anything the board can do to be supportive of the university. I want to thank you for earlier this year for hosting the testing on site that you moved thousands of people through campus.
Absolutely.
And I believe that you're still doing so.
Yeah.
Out
Thank
there.
you for your support.
Absolutely.
Yeah.
Janice, do you have Marie?
We do. Here she goes. Maria, there she is. She is actually from, I think, posting from a medical facility actually this morning. And so, Marie, if you can hear us, we'll turn it over to you.
I can. Can you hear me?
Yes, thank you.
Okay, great. Thank you. I really apologize for not being there in person. I appreciate your deference this morning and letting me remote in. I'm having a family medical emergency this morning, so it's kind of the best way to handle those situations, I hope. If I may, if the doctor comes in for consult, I may have to leave more quickly than I anticipated, but I'll do the best I can. I'm going to share my screen so you don't have to look at me in the mask. Let's see if I can do this right. Come on. All right. All right, so you should have the cover slide up there. And we'll just go into some of these details. They should be fairly familiar, similar to what Dr. Lanza has presented in the past. Yesterday's report out had total cases in Escambia County a little over 8,000, with about 7,500 of those being Florida residents, and the median age in the upper 30s. So not a whole lot different than what we've seen in the past. I think the median age has ticked up just a little bit over the past few days or weeks since the last time Dr. Lanza was speaking to you guys. So seeing a little bit more of an older population as the median age goes up. And as the median age goes down, that usually means that there's more younger people with it, because that number represents the midpoint of the case numbers. This is just kind of a timeline of daily confirmations. Yesterday's report being about a little over 100.
Excuse me,
And
Ms. Gordon, can
again,
we
a
enlarge the
median
screen
age.
by any chance up there? Can it be enlarged for the? Thank you.
Is that better? Okay. So the left timeline here, case confirmations by day, and then median age by day. So again, you can kind of see at the high point of 58 at the end of July, and then kind of going back down to kind of the upper 40s, low 30s. Race and that ethnicity, I don't think has changed, again, a whole lot since the last report. So you can see number of cases, about 39% of cases in white population, 26% in the Black population, and then another kind of unreported or unknown, about 28%. And then the hospitalizations, you'll see 47% in the white population, 44% in the Black population, and then a small combination between other and unknown. And then in deaths, 57% in the white population, 36% in the Black population. And the bottom corner is covered by my room view, so I can't really see what the very bottom of that is. Turning I have paper notes too, paper pages too, just in case. Hospitalizations cumulatively at 491 to date. And I think that 7% is up a little bit. I think the last report that Dr. Lanza gave, that was about 6% of cases. I'm sorry, 5% of cases, so up a little bit from previously. And I think we're seeing that, when we converse with the hospitals, seeing a little bit more stress on them from hospitalization cases. And again, in the long-term care populations, not really a change in the percentage of cases here since the last time this was presented to you. So about 10% of cases in our local population are long-term care residents. The correctional cases, we had the issue with the Merlin cases don't necessarily reflect what we know to be real time, and I think that's going to continue to be that way. So trying to keep a tab on what's going on with the jail is going to be, a local way to manage that data. This is age-based, age group based here, and again seeing, there we go, new cases here and all cases. Again, we're still kind of see the bulk of those in that 15 up to about 55 to 65, this grouping here. But I think this is not as extreme as it has been in the past. So again, seeing a little bit more in this older age group showing up. And then the testing, reporting, again, from our August 5th report, all of these, I think the other slides were dated, but this one is not. Total tested in Escambia County, about 67,500, with about 8,300 positive total cases. Those are not residents, those are all the tests in Escambia County. And this kind of overall cumulative positivity rate of about 12% is above that 10% target we're trying to get to. You can look down here and you can see the daily percentages, because these are the daily returns for test results. And it kind of hovers just above or below that 10% target. I think today's is going to be slightly below, like yesterday's was. And this is, again, another kind of familiar chart looking at emergency department visits with some key symptoms: cough, fever, shortness of breath. And when Dr. Lanza's last slide, you saw a segment that went from prior to 5/7 to about July 9th. So this part of the graph you've seen before. So you can see it kind of peaked over the interim and appears to be dropping off just based on this snapshot. And the same thing for the flu-like illness emergency department visits. Previously, you'd seen probably about this part of the graph. I think it kind of went up from here, and it seems to be tapering off over the last couple of weeks here. And similar here for the COVID-like illness. And the CDC continues to recommend wearing cloth face coverings. The graphic here is from the campaign that the Florida Department of Health pushed out around the 4th of July with just the basic calls to action: wearing masks, keeping 6 feet distance, avoiding crowds, staying home when sick. And on July 20th, the State Surgeon General, Dr. Rivkees, updated the public health advisory. So the July 20th one reiterated the March 25th and June 20th public health advisories and kind of updated it. And the key update involves the recommendation about size of social gatherings. But just to kind of reiterate, Surgeon General is recommending all individuals in Florida should wear face coverings in any setting where social distancing is not possible, with some exceptions. For example, children under 2 years old, individuals with certain medical conditions, individuals obtaining certain services that require access to the face, certain professions that, again, are delivering or needing to be unmasked or delivering services related to that, and individuals engaged in outdoor work or recreation where social distancing can be managed. Face coverings, however, are not a substitute for social distancing, hand washing, and staying home when sick. So those are going to be some key messages to continue to push out. The Surgeon General in number 2 recommends limiting the size of social gatherings to fewer than 10 people. So, and in those situations, again, continue to practice the social distancing, face coverings, and other preventive measures. And then protecting vulnerable populations targets individuals over 65 and those with serious medical conditions that put them at higher risk for COVID-like complications. And again, I consistently see messaging from the CDC and from the state and the Surgeon General's office, reinforcing the need to continue social distancing, hand washing, and staying home when sick. On August the 3rd, the governor pushed out the One Goal, One Florida, and again, similar messages. This was sent out in a Department of Health Joint Information Center press release on the 3rd as well, so there's a link in there to this. And then the other call to action here that people can engage in is texting FL COVID-19 to this number 888-777. And if you haven't already done that, or if you have done that, you'll know that gets you links to messages and information from the governor's office. And that's all I have.
Board? Commissioner Underhill?
Thank you, Mr. Chairman. Out of all of those slides, it's nice to see those graphs that have peaked and heading downward. Hopefully that is not a fluke, but in fact going to continue. And I think as we look at that peak too, that also kind of coincides with that period of time where we had some issues with data. But that downward trending is very clear and certainly is an indication of our of the community's commitment. I mean, we've done a fairly good job of turning that around. Continued commitment to that, I think, continues that downward trend. But the one slide that you had that showed 67,000 tested is the one that I really want to draw attention to. 67,000 people tested in a county of 320,000 people. Now, I realize that all those 67,000 tested were not Escambia citizens, but I think that that number, 67,000 tested in a community of 320,000, I would put those numbers up against any other community in the nation. I don't think anybody can demonstrate that level of commitment to testing. So, and that really is a partnership of so many different people and organizations that came together to make that happening, including the University of West Florida, who was up here just a moment ago. And it's important to note that today, starting about 20 minutes ago, we have a mobile test site at Escambia County Equestrian Center that'll be open until 1 o'clock. Walk up. If you're an adult with a citizen and you've got an ID card that shows you're an Escambia citizen, you get your test. There should not be anybody in Escambia County who wants a test and cannot get one. And so, that slide right there and that level of commitment, to me, that's a hats off to every single staff member, organization, and association that has helped us get that. That's something to be proud of. Thank you.
Commissioner Burgash?
Yeah, and just to tag along to what Doug said, yes, that's absolutely true. Today in District 1 at the Equestrian Center, you can certainly go, and we're going to provide, we have the capability, capacity to do up to 250 tests with an immediate turnaround within 1 hour, which is amazing, and it is a testament to Janice. Thank you very much for getting that done. Eric Gilmore is over in Tallahassee right now. He's been working on another issue, the storm that went up the East Coast. But while he was there, we were able to make that request. And so we thank the state for sending that resource. Tomorrow, that same bus that is doing this quick, rapid mobile test will be at PSC's Warrington campus in District 2. So we would recommend anyone either today, get up there if you can, or tomorrow, and you'll get a rapid test return. And again, the testing in Escambia County has been robust, and we're very fortunate. What I'm looking at today in the numbers that really is good to see is on our own dashboard that Eric Gilmore maintains for the county, which is really a great thing. Go to myescambia.com and look at our dashboard. It's fantastic. The hospitalizations have really gone way down, which is very encouraging. And then as I look at this chart here that was provided today, I see the positivity rate, which is the important thing to look at. You look at the total number of tests, that's fine, whether it's a big number, high number, not the total number of cases. The positivity rate is very important, and that has dropped several percentage points down below 10%, which is the target. So what we're seeing now appears to look like we're moving the needle a little bit, moving this in the right direction. So I appreciate the update. Thank you.
Thank you. Commissioner May?
Thank you, Mr. Chairman. And I wanted to acknowledge community health. And so out of the 67 counties, we probably were the leaders in mobile testing and actually started right in Brownsville, meeting with Sandra Donaldson and Sandra Smiley. So I do say that we pioneered that. A couple of questions. That 12% positive rate, is that for the overall testing numbers, or the 12% is the positive rate for Escambia County?
That is for Escambia County for all the testing that we've done.
Okay. And so I do receive what my colleagues say, but I remember sitting on this dais in April when we were at 4% or 5%, and people were like saying that's great. And so now we're at 12%, and I do caution people to think that a 12% is a low rate. 12% is still people dying, and so I think it's very imperative that we continue to adhere to the protocols to get that number down. At some point, we were very proud when we were at 4% or 3%, and now when we get at 12%, some still seem to be proud of a 12% positive rate. A 12% positive rate is nothing that we should grab the rally rag and run around the track like we deserve a trophy. We need to continue to work to bring that number down to the rate in which we had. So this report, Marie, is quite frankly probably one of the best that I've had since March. So thank you for getting this information and adequately demonstrating the data as it is relative to the current situation of what's going on in our community. So thank you, Marie.
Thank you. Board, any other comments? Yes, sir.
I saw here in the 1%, was that 1% positive in our correction centers? And what all was that inclusive of, Marie?
That, let me find that slide. So that number comes from the state report, and we had this discussion the last time when Dr. Lanza was here, how that's not a good number to really look at. It's kind of hard to eliminate it from the slide because the picture is snapped directly from the report.
Right.
But those are the correctional numbers that are in the Merlin system.
And Ms.
So
Good,
those
that,
are taking some time to filter into that system.
and that's what we have on our dashboard for Escambia County. We only 1% in our corrections.
The only thing, the question for clarification is, Marie, does that include those that are in FDOC's jurisdiction as well, like the Century and, like Century?
And I'm not sure about that. I did ask somebody about that kind of information this morning because it is hard to kind of clarify that. And so they're kind of trying to look into that, but I don't really have that information.
Because we've had significantly higher numbers of those that that have tested positive. We do know that today we're sitting at 26 positive in the jail that are currently being monitored and in areas that are on hold.
So
And
does that
it's-
correlate to more than 1%?
We have 1409 in our custody, so 24.
It
All
sounds
right,
like
mathematicians.
So you're today, we've only had, with our correction employees and inmates, we've had more than 24, correct, Administrator Gillen?
Oh, we've had more than 24 that have been positive, yes,
Right,
sir.
yeah. So I just would like to,
Right.
I'd like to figure out what percentage that is
Yeah.
of our correction staff and
Okay.
inmates.
Yeah, we're down to 10 staff that are currently positive that we're still monitoring. So we've gone down from a high of, I believe, 80 that were being monitored and tested, down to 10 currently that are positive and are waiting to return back to, those are corrections officers. And then we have 26 actual inmates. We did have 2 more yesterday test positive.
Thank you, Mr. Chairman.
Absolutely. Robert?
Thank you. Marie, can you go back to what the new graphic is that you guys are putting out of August 3rd?
I think it's the last.
Yeah. So, Madam Administrator, I think this is pretty much the same thing we've been putting out since at least July 2nd. And I know as of July 2nd, I think we'd had 141 media releases that had included at least wearing a mask, I think is what we counted, but probably most of what's in this chart. So I think this is something that Escambia County has been pushing, I'd say pretty close for a while. I mean,
We started with the Be Calm, Be Clean, Be Healthy, and
Right.
then listed all those back in March. So.
and we still encourage these today.
Oh, yes, sir, yes, sir.
Yep. Okay.
Yes, sir, they're on most of our graphics, and we do have them on our web pages. And then I recently sent a memo out to all the employees and reiterated all of these things. It even gave very continued strict instructions on how to wash your hands for more than 20 seconds and things like that.
And right now you can, we are offering masks and sanitizer as supplies are available.
Yes, sir.
And we're at the library,
The COC, we're now,
COC.
yes, sir.
Yep.
And at the animal shelter, we have them, and the community centers already have them.
And then also at Lifeguard Tower 4.
Yes,
Where
sir.
you can ask a lifeguard.
And we've provided a hand sanitizer with a clip on it for our employees so that they can refill and reuse. So,
Perfect. Okay. Thank you.
Thank you.
Mr. Chairman, those
Yes,
are,
sir.
those are all great things, and the administrator and I met yesterday, and I know it's somewhat of a logistical problem, but I think, the campaign's great, Robert, and telling people to wash their hands and give them hand sanitizer, but to me, it would be critical that when we have inmates that are in our care who want to be tested, I'm not saying they're mandatory tested, but any inmate that requests to be tested, I think should be tested. And I know that that's been somewhat of a challenge, but I would love to have support in whatever, I mean, I know it's difficult, Janice, to do that, but I want to move in that direction, not only for the inmates, but for the correction officers and the safety that work there. If someone desires to get tested, let's figure out how to get them tested.
I did have a conversation with Chandra, as you and I mentioned, and she has provided to us information about the rapid test. So we currently don't have a way to do the rapid test right now at the jail, but she is hoping to have materials by September so that we would be able to do that from that
So
perspective.
regardless of how it gets tested, I'm supportive of testing people that want to be tested that are incarcerated with us as well, regardless of how they're tested. Commissioner Unreal.
Thank you, Mr. Chairman. Yeah, Janice, when we take the liberty of a citizen, we take on the obligation and responsibilities because we take away their ability to go and get tested themselves. So yeah, I really don't care what the cost or time involved is. No citizen who's incarcerated by Escambia County who asks for a test should be denied a test. Thanks.
Commissioner Bender.
And Jen, if we can expedite it, it is somewhat of a pandemic of a concern to employees and loved ones who have inmates there. So I don't want to, kick the ball down to September. If it's more efficient in September, great, but if we can start it immediately, I think that's something that that should happen.
Commissioner Bender.
Yes. Can we get some clarification on the rapid mobile test site? It sounds like it's only today, and then in our update, I don't see that it was going to PSC tomorrow. Is that something that's only around for these 2 days, or is that
So
here to stay, or?
So the Department of Health is managing that, and I'm not saying Marie specifically, I mean the State Department of Health. And so Eric is actually at the DEM, at the EOC, working on finalizing it. As you know, we didn't know until 3 o'clock yesterday that it was actually going to come today. We were thinking it was coming next week. And so they are working on the actual location. They did ask permission at PSC Warrington yesterday afternoon, but they may actually like the Equestrian Center so much, they may stay there. So we're still working on so the communication is coming from them in different ways. And so Eric is currently on the ground trying to get that resolved.
But do we have a time frame for how long they'll stay?
It's today and tomorrow. That part we have been told.
Okay, but next week is as unlikely, or?
I would not say unlikely. I would say the way this one has gone, they could be back, but I can't speak for them. We won't know.
How many tests do they have? I heard Laura told me you said 200, and is it 1,000 or 200 that they are able to perform? How many test kits? do
Marie,
they
I
have?
don't know if you know.
In my conversations with Eric, the number I got was 200 per day.
So it's 200, is that what we're saying?
Per day.
200 per day?
That was my understanding.
Yes.
Yes, yeah, Laura's email.
That's what
says-
it is, 200?
Laura
It's
says
200 per
up to
day?
200 tests.
Per day? And so we'll get 200 today and 200 tomorrow?
I'd say her email only discusses today's event, so
So, I guess we
Presumably
would
it would be
anticipate
200
200 today and
and
200 tomorrow. Do we have the ability to request for it to continue, Madam Administrator?
Eric is,
So-
I
so
can
May-
try and get in touch with Eric to see if he can help us get it. So this is one of those examples of, it is a gift and we appreciate it, but, last minute has been very difficult to coordinate with them. So I'm hoping that he can get us more specific information before you get out of agenda review.
do we, is this the one that is experiencing some false negatives? And to clarify that is when someone is positive, they get a result of a negative. And so I know there's been some concerns that I've seen regarding the rapid testing. And I know that they're working through that and getting better. But of course, if someone
Chandra-
gets a negative when they're really positive and then they carry on as if they're fine, then that's where you can lead to.
Yeah, I do have the paper that Chandra provided us a paper from Abbott Laboratories regarding the rapid test. I could only assume that this is the same rapid test that the state is using. I don't know for sure. So Chips, I don't know if you want to talk about the,
Commissioner, there were some reports back in April and May out of New York University where there were some false negatives, where people were really positive, but the tests were coming back negative. Since that time, Abbott has modified the process to reduce that false negativity. And this most recent paper that just came out in the last few weeks shows the results above 90% accuracy.
And that's on false negatives, and what are false positives?
The positives are coming back close to 98%. Those are very accurate.
Okay.
I did want to mention one other update. The number that I had mentioned of 26 inmates, that was yesterday afternoon's number. We're now down to 10 this morning of those that are under observation from having tested or having shown symptoms. I just want to make sure that number was correct.
Marie, I want to talk about the 10% number real quick. That's, of course, something that has been indicated as a more acceptable number. But of course, we want it to get it as low as possible. I mean, can you give me some reasoning behind the 10%? Of course, 10% positives, if you do 100 tests, that's 10 people, but if you do 1,000, that's 100. And so because we are testing a lot, of course, even that 10% number being flat means we are having more cases. And I think the concern here is, of course, how is the hospitals being able to handle patients and care for patients. So are you able to expand on that or why that 10% number or how it came to be?
Probably not very well, to be perfectly honest. That is the target set by the state, and a lot of that has to do with trying to maintain, capacity of response and medical care. But to drill down into how that became the magic number, I have to do some more research for you.
And of course, we're at 12% for the length of the pandemic. And so are they looking for a 10% over a 2-week period would be you're in the right direction, or because that's what this chart here is off of, or
Right,
are we trying to get
number,
that overall number back to below 10%?
Yeah, this number is the overall number that spans the length of the testing. And we would like to definitely see that below 10%. I think looking at, a 5 to 7 day kind of rolling, and that's what this chart kind of tells you, is going to be kind of key. So we see, we've seen some spikes back late last week, and then some drops. And I kind of think as we can kind of see that overall kind of moving down below that 10% line, that's going to be where we're going to have the best kind of response.
But with that being said, I think we are asking everybody to be proactive, and just because we get to 10% or below doesn't mean that we stop doing these measures that we're doing.
Right.
Right. I think we definitely don't want to get complacent. We want to continue to put those basic prevention measures into play day after day. So the hand washing, social distancing, wearing a mask, avoiding crowds and congested places, staying home when you're sick are going to be key habits for everybody to engage in. I think Dr. Lanza referred to it as a shared social responsibility to help.
Perfect. Thank you so much.
Commissioner?
Marie, I mean, in your opinion, in your expert opinion, are we seeing the peak, you believe, in Escambia County? That's, question one. And question two, should we anticipate a large influx when school starts? And, how would you recommend we prepare for that if it is? And I guess my third question would be, How are we coordinating when they're doing the rapid test? Obviously, if they get a positive, we want them to go and take, well, I guess, the deep swab. Are we coordinating with the people that are doing the rapid testing to get people where they need to be to do the second test if they get a positive?
For the rapid test mobile, the response mobile that's in town today and tomorrow, excuse me, I'm losing my voice.
You're fine, take your time.
Let me get a sip of water. See if that helps a little bit. So I feel like I was under the impression that if they did the rapid and it came back positive, they would do a swab as well at that point. I can't swear to that though, right off, I don't see it in writing in front of me, so that always makes me a little nervous. In terms of the peaking, I'm definitely not going to speculate about whether or not we're at a peak and what kind of things are going to happen in the future. But I do think it is, key to try to put those measures into place as much as possible to prevent any spikes or upticks in transmission.
Okay. Thank you, Mr. Chairman.
Sorry, one last question. Is the Department of Health recommend, of course, we're saying wearing a mask, but there are a lot of different things that are being used for masks. Are they giving any guidance so that if people are trying to do the right thing by wearing a mask, that they're also taking the appropriate step in wearing the right mask? So I know recently Disney revised some of their guidelines and saying that it can't have holes in it, that the filter ones can't be worn. Is the state putting out any information so that, again, people that are trying to do the right thing are doing the right thing?
Currently the Surgeon General's advisory very specifically states wear a face covering over the nose and mouth. So it doesn't specify what type of mask, but definitely to make sure the mask is worn appropriately. I do, on more than occasionally, see people with, half covered or not covered at all, but the mask is on somewhere. So, wearing the mask over the nose and mouth. And then, beyond that, I would recommend following the CDC guidance on masks, which I think is currently still just the cloth face coverings.
Okay.
But they do have some expanded guidance for occupational masking or different types of situations.
But I think we're also not saying though that a mask, they're saying that the mask reduces the chances, but it shouldn't be used as you shouldn't feel like you're wearing a shield because you have a face covering on. You still need to take these other precautions, and if you are in a high-risk, vulnerable population, probably take additional measures when going out, even if you're wearing a mask and other people are wearing a mask, correct?
Right. For vulnerable populations, really, the recommendation from the Surgeon General is to limit any personal interactions outside the home and take all measures possible to limit the risk of exposure. So, and then in all of these advisories, there's a caveat for hand washing and social distancing as much as possible, and staying home when sick. So it is a combination of tools. They're all important.
Thank you.
Thank you, Board. Any other questions? Marie, thank you for being here. Hope to see you again in the future. But thank you very much for your time.
Thank you. Yeah, thank you for being flexible with me today.
Good luck to you and your family today.
Thank you, Janice.
All right. Absolutely. Board, and I apologize, I was blocked to see Mr. Mayor in the audience, Mayor Grover Robinson from the City of Pensacola. I did see Ms. Lavoy in the audience. But I don't know if anybody would be opposed to maybe moving the CARES discussion up for the fact they're here.
Absolutely. It's good to see the mayor. I've worked closely with him. Certainly would like to move it up.
All right, super. Janice, let's skip to that. Let's go to that.
Okay. All So one of the things that we just wanted to provide you was, we wanted to provide you with a wrap-up of the public health campaign that, that we did in July. This is, and we can make sure that everyone has a copy, but this is just the purpose of the campaign, and then what we're showing you are the different tactics that were involved in terms of the print, the social media, the digital, the email, the outdoor. And then this shows you the different organizations that we worked with in terms of providing those different messaging strategies. The radio, the print, the television, the social media, and you can see we've tried to provide you with the reach, the number of impressions, click-through rates, and things like that for each of these different mediums. Display, digital display, outdoor advertising, and then here we go, here was the budget. And then this is what some of the other hospitals, last time we met, you all mentioned, and it was mentioned that there were folks that were waiting, unfortunately, sometimes too late to go to the hospital to seek care. And so the hospitals have done a really good job of trying to get that message out. And we're also in partnership trying to make sure that we're getting that message out, the Be Healthy Escambia, and we're specifically targeting WRNE and working with them. And this is a list of when those radio interviews are being done throughout the month of August. And so we are trying to make sure that we're getting the messaging every single place we can from a CARES perspective, public health campaign, so that we can, oh, I didn't realize the graphic was going to work.
Such as diabetes, high blood pressure, or need medications, don't wait.
For your prescriptions to be prepared if there's a hurricane.
Telehealth may be your best option for care during COVID-19. Simply go online or call your doctor.
And there are options for low-cost health care if you do not have insurance.
Take care of yourself today.
Be calm, be clean, be healthy, Escambia.
So we've, like I said, we're working in partnership with WRNE to get this campaign out, specifically to some of the communities that we have been made aware that might be waiting or delaying in their pursuit of healthcare and attention. So whenever you, let's see, all right, so here's the CARES. These are slides that you've seen before in terms of the way that CARES funding has been provided to us from the Florida Department of Emergency Management. This is a slide that demonstrates to you all the different ways that the county has received funding through the CARES to this date. You can see the $14 million, that's the big FDEM CARES Act agreement. That's the 25% of what we've received. The EMS fund, that was, we received that about 6-8 weeks ago. Department of Justice, that's the one where we split some of the funding between the jail and the sheriff. The FEMA, that's a small supplemental. The next one is the housing. That number does include the city's portion, the 903. You have the CDBG funds, which you've all been made apprised of. We have the FTA funding, the CARES Act for operating and capital assistance. That's the one that Tanya has brought to you all. And then the last one is, Tanya's also brought you the one related to the formula grant for the rural areas, the ECAT.
Madam Administrator, sorry.
Go ahead, Robert.
Do schools have their own pot, or are they not coming through us?
They have not been coming through us.
But they have access to?
Yeah, they
They're getting
have.
funds, I mean,
Yeah, okay. Just because I haven't, I mean, no one from school board or anybody's asked me anything, and I haven't seen it in any of our documents, so.
Nope, and we have had conversations, and it's my understanding they've not made any requests to us.
Okay, thank you.
The next one is related to, these are the different pots. Chips and I have had numerous conversations with outside organizations and agencies, and we've also looked at the other communities around the state and looked at their funding sources. And there is no cookie cutter. Everyone's doing it differently. This is just something that we would recommend for your consideration. The first one is for you to consider that we would do individual grants to families, and it would be your decision whether or not we did a $1,000 or a $2,000 per family. There are some basic metrics that need to be met in terms of qualifications for that grant, because as you know, we have to report back to the state and the federal treasury on how we've spent these funds. And then you can see the next one would be a business grant, which is not an uncommon grant that is provided in many communities. We have been working with Scott Luth at Florida West, Todd Thompson at the Chamber. We also have, they have in conversations included Mr. Wire and, Kelly Massey at the SBDC at UWF. So that is one of theirs. We will have, hopefully, the SOPs to bring to you in the next couple of days for this particular grant.
And sorry, on this top one, it says applicant annual income less than 75,000. So would that be individual household? Do we have a household number? Just because we have 1,000 to 2,000 per family / household. So I think we would need to clarify if that's 75 individual, 150 household, or,
Yeah.
I think the intent was that would be for the family or the household.
for the house, okay, so,
And then the 1,000 to 2,000, I believe we were going to ask the commissioners to sort of decide on what funding level they wanted to do for that.
okay. And then when I think the housing assistance is next, but I think we would need to make sure that any payments go directly to the landlord on the applicant's behalf, or to the
Meredith can speak to that. She may not be down here because she may be thinking that it was going to be done a little bit later.
Okay.
So we are working on the qualifications for those grants as well. But I do think that there is some thought I understand what you're saying about it going to the landlord, but a lot of times when people call, it is the individual who's calling for the assistance. So but we do get both ways.
and that's fine, but I think it would be sent on their behalf, but, I'm getting calls from landlords that haven't had any income, that people aren't paying, and then if they get some money to pay for rent, and it doesn't go to that, then, I think then, that's not what they applied for.
Robert, I will say, I think some of the thought is that those folks would have also been eligible for PPP. They would have been eligible. That's their business model. If rent is their business model, there's other eligibility sources that they've been previously eligible for, I think. And I don't disagree with what you're saying, but I do think that the focus, at least initially, being on recipients that have not received aid so far is, as much as we can narrow that down, I think that's important. I think that's the way that the LAHEAP and some of the utility assistance programs, they're paid directly to the provider. And if we utilized a portion to go directly to the owner rather than the occupant, then, I think I'd be open-minded to that, but I don't know about that being an across-the-board policy.
And Commissioner, if I may, I know in a conversation that I've had with Clara and Meredith, some of the other funding that Janice mentioned, the CDBG funding, that does, my understanding is that does require that payment be made to the landlord or the owner. So there are other sources of funding that do have that requirement.
Janice? Or Chips, whoever.
Okay. The next one is the rapid testing. So we've had some very good conversations with Ascension Sacred Heart and also Community Health. Chandra, so Ascension, as you can see here, they would be able to do up to 30,000 tests through December 30th. And then Community Health Northwest, our conversations with them have been about them purchasing up to 20,000 kits, rapid test kits. And the good news about that is there is a shelf life there that would extend potentially past December 30th. So that's what we're hoping to do with them.
Hello.
Hello, Jason.
Jason Rogers, Public Safety Director. I just want to follow up with communication with Eric Gilmore. The rapid testing that we have going on right now, Commissioners, is available for 2 days.
Okay.
So we will have that for the next 2 days. We are currently working on a backup plan where a trailer will be brought in by the state for testing as well. However, the trailer possibility is not rapid testing. So the rapid testing will be here 2 days. I believe we can get it 2 days at a time, but it's moving around the state is my understanding. So that's the latest information from Tallahassee. Thank you.
So Community Health Northwest has provided us with a recommendation for 20,000 tests. And like I said, they do have a shelf life. So as Chips and I have been looking at the CARES, one of the things that you can do is you can purchase things for future mitigation and response. And so in our conversations with Chandra, she has provided us information that we may not, even if we don't need 50,000 tests between now and the end of December, we may have some that would have shelf life and be able to be used like in January, February, if for some reason any of the legislation that's not going through, to extend the deadline past December 30th doesn't necessarily extend that deadline. The next one is a program related to food delivery. Food, as we've been talking, there's been over 2.1 million pounds of food. I know that Feeding the Gulf Coast has already provided, and then there are also numerous churches and other partners that are out there providing. And so we would work through those large distributors, for lack of a better term, like Feeding the Gulf Coast, the USDA, and others, to make sure that we provided those. They have all, the ones that we've spoken with have agreed to do what you would call drop ship at those particular organizations and be able to continue to provide that food delivery. First responder childcare, we did talk previously about trying to.
Janice, 1 second, Robert.
Thank you. On the 15% at the top here, is that, I mean, because we're anticipating of extrapolating this. I mean, this is of the 25%, so.
This is only for the initial allocation. That 15% would be of the initial allocation.
Okay, so it wouldn't be moving forward.
In our conversations, it does appear that that's all we would need would be a 15% of the first initial allocation.
Okay.
So that we could get both of those up and going they would go on, they have to sign contracts, of course, like we would have to. The subrecipient agreements, so that we could move that forward. Now, first responders, there is a need to help to continue to offset their child care. I believe the number that he gave us was there were 500 first responders that were needing some child care expenses to get them through December. Then we've met with Marcus McBride. We discussed with him the impact to students that are in training programs from March to December. Some of those are medical training students, and so he has provided us a number, I believe the number's around $99,000 that they need to help us get those students through. And they could only be students that had been impacted due to the COVID. And then we have the community and rural broadband connectivity that's an issue to make sure that our community centers are up to speed and our libraries so that we can handle more bandwidth if we have more uses based on folks having to do more remote learning. And then also the homelessness, hand washing stations, laundry places, and those kind of activities. Chips, did you have anything you wanted to add on these?
I know the mayor has talked about a day center for homelessness, and so he may want to talk about that at some point.
Mm-hmm. Public health and safety, this one relates to EMS, PPE. These are all the things that we're trying to do in terms of managing this for our public safety and our first responders. The next one was a pot to that we've discussed with our constitutionals and the city. It's more related to specifically things that you would provide as a governmental entity to continue to provide services. And then the last one would be a replenishment pot. Some communities have as much as 25% in their future expense pot. We put 5% in there. But see, like after the initial allocation, that 15% that was used for testing, there would be some capacity there to put into a replenishment account in the future.
And Commissioners, these percentages, Janice and I have been talking about this first 25% allocation that's come to the county as a pilot project. It's going to be for 5 months. We're going to look at these percentages, and then in December, when this is over, we'll reanalyze those percentages, and they possibly may change for the next distribution of funds.
So when do we expect the rest of the cash flow?
Well, we've not gotten clear direction from DEM yet as far as how we would go about the reimbursements for the other 75%. They could start coming in as soon as we exhaust the first 14.
Okay. I would be surprised if this first allocation lasted for applications for 3 months or over 3 months. That would seem surprising.
Mhm.
So, I mean, if we have the, if we have the funds before then I think we would be changing all these proposed dates and timelines, right?
Well, so you're talking about from the initial, so you could extrapolate that 25%, you could maintain that 25% for the whole 100% of funding, the whole 57 million.
Yeah, I don't know if that seems likely, but my point is, the first allocation, based on other communities, the way that the grant monies or these monies have been encumbered or solicited when the window opens, it wouldn't seem likely that that amount of money would last for applications to be taken into November and stuff. That just doesn't seem likely. Does it?
Oh, like the business grants?
Like the money will be gone, I guess I should be.
Yeah, that's
looking at
what
it.
you're saying. You're saying it would
Yes.
be expended. Yeah.
Yeah, or encumbered, maybe not expended, but encumbered.
Yeah, it just depends on the capacity. We've had several conversations with organizations and other communities where it's kind of difficult to get all of the money out because sometimes, so for example, the grants for the business grants, what I'm being told is that anything less than 10,000 in some cases is not really enough for people to take the time to apply. So you may not expend all 3.5 million. I know that seems hard to believe, but that's what we've been told from other experiences. And so
It's hard to believe based on my conversations with people wanting us to get their programs up and running. They would, the $2,500, $5,000 would be, appreciated at this time, especially if PPP doesn't happen again.
I would disagree with whoever said that. We gave out $50,000 or 1,500 grants, and we could only give out, 40 or 50 grants, so we had over 135 people to apply for 1,500. For particularly small businesses, I think they would apply.
Robert, I'm sorry.
Thank you, Mr. Chairman. I guess, if, Stephen asked my question earlier, is how do we get the other 75%? And if business grant assistance and things like that are part of that, then I think we just go ahead and increase that funding amount towards that. Maybe you have it in phases, and say, hey, we plan to do it, we'll say 4 times.
Yeah.
And we're gonna put 3 million towards it each time, or rental assistance, and I know Meredith is here to answer those questions, but, I think for some of those programs that we need to help our citizens, go ahead and extrapolate that figure out and start spending it and start pulling down on those next funds. But to sit here and only try to spend the 25% initially, we have a request from the city for 10 million. And that's of the 57 million. That's not out of the.
Yeah, and I don't think we were saying spend only the 25% from now until December.
No, I'm not saying you
okay.
said that, but I think this discussion is to lay out that plan. And I think we need to be looking beyond just the 25% initial allocation.
The PowerPoint says that. I'm not saying that's necessarily what you're verbally saying, but that is what the PowerPoint says. It only lays out the 25%.
Right.
Clearly. And I've got one question on this line item. Submit final reimbursement request to DEM. Aren't we just documenting, I thought we're just documenting expenditures. We have the funds, these funds. How is it reimbursement?
So the second 75% is on a reimbursement basis.
Okay, I mean,
They
that's not
won't-
that's not what the slides say. That's okay, I understand what you're saying. That's not what the slides say. Okay.
I'm sorry, Commissioner, that was probably a poor choice of words, but it would be submitting the final report to DEM for the expenses that occurred during that first 25%.
Okay, so it's just documenting.
Yes.
Okay, that's a better, I mean, it's a better description of what it is, actually, than what's on the screen. Commissioner May?
Chips, these sub-recipient agreements, I mean, do you already have a list? Or have you put out an RFQ and RFP to the sub?
Well, Janice and I have certainly talked to Ascension and Community Health about the subrecipient
So
agreements.
who are,
for the
who are all the
rapid testing.
sub-recipients?
Ascension, Community Health, and also feeding the Gulf Coast. Were those the three we talked about, Janice?
Those are the three that we've talked about today. Mhm.
So how would
And then-
other organizations apply?
Well, it would depend on the organization and what they're applying for. If it's a business, then of course they would fall under those business grants. If it's a family or
A
individual.
human service provider, a food provider, a social service provider, a
Feeding the
drug
Gulf-
rehabilitation provider.
Feeding the Gulf Coast has 44 community partners that they deliver food to, and they can certainly add to that list if there are other partners that we want to add to that. So Janice and I had thought that having that subrecipient agreement with them, because they do the major distribution, would be the most efficient way to do that. Remember, we've got less than 5 months for this pilot project to occur and to spend that first 25%.
Well, I mean, that's,
Well, our
mean,
goal
that's-
is to spend all 100 in the
that-
5 months.
that's
yeah.
one reason. I mean, we're talking about applications. I mean, why don't we close applications and at least put out words that we're going to close at the end of, whenever we get the program stood up, give them 30 days or something, rather than December 1st. I mean,
Well-
it doesn't seem feasible that there's going to be any money left by then. And if the goal is to get money out, let's tell them that, they've got 30 days to apply.
Commissioner, what other communities have done that seems to have worked well is they'll open up the portal for applications for 2 to 3 to 4 weeks.
Yeah.
And then they'll close it and they'll
Yeah.
look at those applications, they'll distribute the funds, and then they'll do it a second time.
Well, let's say we're going to do that then, rather than saying,
Yes,
I mean, again, the slide, that's not what the slide says.
Chips, I agree with Commissioner Berry, but other counties and other places have had problems with the sub-recipients. I mean, the city can be a sub-recipient, I understand that. Feeding the Gulf Coast can be a sub-recipient. But any not-for-profit almost that's providing services could be a sub-recipient. And then once all the money has been expended, there have been groups that have been left out as they got rid of the money. And because it goes pretty quickly, although we were saying it's going to be a challenge. I mean, it goes pretty quickly. And there are segments of population that get serviced by different organizations. So there needs to be inclusion and diversity in those groups that get a sub-recipient agreement. And so for me, Mr. Chairman, that's going to have to come back to the board for me, because ultimately, I'm the one that's held accountable for making sure that these services are distributed to my community and to my district.
Correct. I understand. And Janice and I's thoughts are, because this is such a short-term period here, this first 5 months, that second 75% will have a much longer time period there to really look at some other subrecipients and some other organizations.
And I certainly understand that, Mr. Chairman, Stephen, but that 25% share could be detrimental to me in my community. So I get getting it out quickly. I wish we would have got this, quite frankly, I wish this would have been out on the ground 60 days ago. But haste makes waste. It has to be distributed equally, the first 25% and the second 75%, for me to be supported, Mr. Chairman.
So are we going to see the subrecipient grant agreements, the subrecipient agreements?
Oh, yes, sir.
All right, and are we going to consider every, John Doe's family gets $1,000. I mean, are they, by the terms of this, going to be considered a subrecipient? I mean, that's by definition that. Is that correct, or is that not correct?
There will not be a subrecipient agreement for every business and for every individual, no.
Okay, so are we only going to have subrecipient agreements for people that are then going to funnel money out to other agencies? Is that who are going to? Okay.
Or, yes, or if they're an
Okay, we need to clearly define what a subrecipient agreement.
Yep.
Who's gonna be the-
Absolutely.
who's
And
gonna
we
be the
already have
recipient of that.
examples of those, and they're pretty long. They're about 30 pages. But that is one of the things, that's why we've asked to bring on a consultant to help us manage these, because everyone is having issues in terms of ensuring that they are making the most of all of their different pots of money, like we have, to make sure that we are getting the most for that particular money. And that's why one of the things in front of you is the integrity group, to bring them in. There are other communities in the Panhandle that are using them. Okaloosa is one of the counties that's using them. Santa Rosa is using a different group. So one of the things that's part of the subrecipient agreement is what you would call a mandatory risk assessment. And the reason why that's key is because this county is on the hook. Any penny that we spend, or any thousands of pennies that we spend that is rejected either through DEM or the Treasury, we are responsible for ourselves. And so that is why having that extra set of eyes is really important in terms of how we are expending these funds.
So the marketing of these chips and how people get the information, I was doing that in-house, or are you looking for an outside firm to help you with that? I mean,
So they have the Integrity Group actually has a portal that Chips and I have already looked at. Many of the other organizations have a portal. Meredith will have a portal where that folks can apply. Our goal is that every portal that we have is very clear about the fact that all the information that's being provided is public record, and that we will be posting. We've already worked with the clerk's office to ensure that every check that is written, depending on whichever bucket it is posted publicly, so that there is complete transparency from beginning to end of this particular process. When I was speaking with Kelly Massey and Scott Luth and them, they're also making sure that the businesses know this time around that when they apply, all the information is public. So our goal is to make sure that the public portals that we put out there are available and transparent for everyone.
so I would just be concerned, I mean, many times those who need the resources the most don't necessarily get the information, so I just would be
Commissioner,
reluctant, and I would hope that, I mean, we're people, we have social services agents locally. I mean, that's what we do. We have a human service department. Chip, you work with the Treasury and Restore. I mean, I would consider you the expert, and I would consider you closest to the ground in making sure that the information get out. I mean, an outside consultant that's laser focused on multiple counties is not laser focused on my district, nor is he laser focused on my county. So that gives me concern.
and Commissioner Janice and I have talked about working with our CMR department to make sure that the newspapers, TV, radio, that all that information gets out for when that portal's going to be open for the 2, 3, 4 weeks for applications. So we'll make sure that that information is well distributed.
And
Good, okay.
And we've also talked about using Brownsville as a place where folks can come and be able to make sure that their applications are managed there. We've already had conversations with Clara and her team about that. So she's prepared. She's just said that she's prepared, and her staff is preparing. We're also working on making sure that our Citizens Information Center is up and available, so that as people have questions, we have ways to direct them to be able to help them to fill out the applications, particularly for the individual and family applications.
Well, I appreciate it. I'm just not going to risk my reputation or my service to my constituents on an external consulting group. There's going to be somebody that I can see, touch, and feel that's going to make sure that information gets out to those who I represent.
I'm still very reminiscent of the failures of Dewberry.
Oh, I was there. I mean, so I'm very reluctant to any of those outside consultants, because we're still paying for worksheets that were never done by Dewberry. And quite frankly, we ended up doing it ourselves. I mean, Amy's out there right now. We ended up internally having to do it because we relied on the consultant that when the rubber hit the road, they took their check and went down, and we were still receiving the phone calls. And long after this coronavirus is done, they will still be calling the 595 numbers that start with a 4 on the 4th floor.
Right, the banker's boxes of papers that were
And a free
unfilled
office.
out. Yeah, crayons
And there will be
stuff.
principals this evening from the consultant group. If you have any questions, they'll be here for you to answer.
Robert and then Doug.
Thank you, Mr. Chairman. And Commissioner May, I think it's important that, for me, it was about getting the money into the hands of our citizens and not lining the pockets of a consultant.
Amen.
You know, especially if, you know, I mean, some of the rates that I heard that they were charging in some of these other counties, and, I mean, I want that to go to the people in Escambia County that need the help and not just, I understand that it's difficult, but given our experience with like firms, and if we have the people that can do it, or even if we had to hire somebody to do it, at least it's helping, staying local.
If I can give a local citizen $1,500 to pay their utilities, light and their water, rather than give it to a consultant, that's what I'm gonna do. I
Yeah.
mean, it's simple. People are not being able to go to work, they're losing their job. Line up the portal, let's line people up and give people the assistance that they need to survive. I don't want to create any more bureaucracy I don't need a consultant to tell me that my district is hurting right now.
But Chips, I want to clarify, because I think I misunderstood what you said, but we are expected to expend all 57 million, if we can, by the end of the year.
By December 30th.
So there's not a longer period to spend that other 75%. I mean, it's now.
Correct.
And so,
It's only extended if the HEALS legislation does end up in Congress, does end up having that included in the final passage. But I would not necessarily bet on that particular legislation at this point. But,
Robert,
yeah.
I'm sorry, Ms. Connigan. I would implore you to call Senator Gates and to talk about the possibility and the reality of things being extended. I encourage you to maybe
Okay.
give him a call.
because it's,
I think it's very realistic.
I would hope so, because this isn't going to end on December 31st. And so, I mean, I think we need to, unless we get more money, I think we do need to be wise in how we spend this, knowing that we may have to make it work a little bit longer. But I think we need to do a rolling application so that those people that get their application in quickly don't have to wait for it to close. Maybe we can have a rolling date so that, you know, the applicants that are in the first 2 weeks can start to get processed as we continue to take applications. And, you know, get the money out to the people that need it as quickly as we can.
And Robert, you can encumber the money and leave flexibility in the language in which you can adjust, because there are too many uncertainties. I mean, we just talked to our medical provider. No one knows exactly what the future is going to hold, and I can tell you there's going to still have to be engagement and interaction from the federal level. So I don't think that anything is actually written in concrete, and I don't think we ought to box ourselves in to December. We need to be as fluid as we can and as flexible as we can, in my opinion.
But, I mean, if and I'm sorry, Janice, if you go back to the last page of the percentages. So I think what probably gives our friends in the back the most heartburn is this 10% number, and what it goes towards. You know, of course, we are all trying to make improvements to our facilities that help prevent the virus and things like that. And I don't see that whatever the city gets would come only from this bucket.
No, sir.
And I would say that that if they have things that fall into the other buckets, that they could apply for those or push those out, and they come from that bucket. But we would probably need a more specific what they need in terms of infrastructure and things like that, similar to what we would be using this 10% on. And I don't want to speak on behalf of the mayor, but I think that's it sounded like the concern was that they were having to fit into this 10% bucket for everything they wanted to do.
I understand.
But as of right now, we don't have a large amount of requests from the other constitutionals, though.
We do not. I know that a couple of them did have to purchase a lot of laptops because they had never really envisioned sending all of their employees home to work from home. I am aware of that particular request. We did provide most of the plexiglass, between them and the barriers between them and the public, and so those would be something that the county would be looking at. So at this time, the main thing I've heard about is related to technology and sending all of their employees home. That doesn't mean that's the only thing, but that is the main thing I've heard. So we have not, at this point, we've not necessarily provided them the way to start reporting that to us. We have had conversations with them, but we've not necessarily taken a list from them yet.
Thank you. Commissioner Underhill. Commissioner Gosh.
Thank you, Mr. Chairman. I will say that I think that windfall money is dangerous money. The fool, when he hits the lottery, he goes to the Porsche dealership first. The intelligent person, when he has a windfall, gets an attorney and an accountant first thing, because he's dealing with an amount of money and things that he did not plan for and that he does not have the background and skill sets for. So I feel the same way about having a consultant advise us and help us with regard to such a hefty windfall. Obviously, I don't have the support of the board on that, but I would say that when we look at our experiences in this county, we should look at them for what they really are and not just for how they feel. The Dewberry failure was a failure of oversight of a consultant. When you hire a consultant, you do not abdicate your duties. Your consultant assists you in decision making. And in that case, we just did not properly oversee our consultant and probably didn't give clear enough guidance. As we were kind of, there was a very politically charged and situation, and certainly the largest windfall that the county's ever known. But if it's the will of the board that we do not seek that professional guidance on this expenditure of the $57 million, then that will be, that'll be what we do. Thanks.
Well, I would truly hope that's not the
I don't think
case.
that's what anybody said.
Yeah, I don't think that's what anybody just said, Doug. I think what we're saying is that, and from my discussions with the administrator, is that we would be hiring someone to make sure that we spend within the parameters of the program, but we're not going to hire somebody to run it for us at $150 an hour.
Right. No, yes, exactly. So my apologies if I if I said that in such a way that hurt anybody's feelings. No, I honestly think that that Janice does need that assistance, but ultimately it's Janice's job to expend that $57 million. No, I don't need like Lumen. I don't need a consultant to tell me what's needed in my district or how to run a county government. But I certainly would expect a consultant to tell me how to properly navigate legislation that was written, on the fly in the middle of the night and very rapidly.
And my discussions is that, yes, we probably do need that because it's the five of us that are held responsible in the end. So
At the end of the day, we're gonna.
right. So I don't think, it didn't hurt my feelings. It just wasn't accurate.
Yeah, no, I misunderstood I had to step out and I was listening on the speaker and back, and so I apologize if I misunderstood your position on it. Totally agree with that we should have somebody consulting with us on the proper expenditure of it, or proper execution of it. Thank you.
And Robert, I concur with you that most of the money is going to get in the hands of citizens as far as I'm concerned. And a proposal doesn't mean acceptance by me. It's going to have to be a reasonable fee. And I guess that's a further discussion as we get into the agenda today. But I'm not interested in paying a large amount or unreasonable amount. It's going to have to be small as it compensates the duties that we expect them. Just because they propose those duties are not necessarily the duties that we need to accept, in my opinion.
And I was going to mention that the firm that we have looked at, we did look at other firms across, that are part of the state contract, but the reason why this firm does stand out is they are predominantly made up of former inspector generals for either FDLE, the chief inspector general for the state of Florida, the former FDLE secretary, another gentleman is from the FBI. I don't believe that any of those gentlemen and women want to end up in jail. And I don't think any of us do either. And unfortunately, this particular program has already had different levels of guidance. Here's what
Right.
you can spend it for, here's what you can't spend
Exactly.
it for. And so it is we do need someone that is spending all day navigating that. Chips has a lot of experience now, 10 years later with Restore, with sub-recipient agreements and things like that with Restore. But that's 8 or 9 years of experience. And so that's the only reason why I would mention that I do believe that this group is a good group, but also I think it's important because they also have to have the insurance, errors and omissions insurance, and other insurance that we've already gotten their certificate of insurance for, that, to help protect us. And so,
And that's fine, Jensen. Those other groups that you looked at, can we analyze and compare their proposals to this group, or did you guys get them from them?
it's from the state contract. We just went on the state contract and looked at theirs, and I'll tell you, like, one of the firms that we looked at, Grant Thornton, which is an internationally recognized firm, when we looked at it, they've had a huge change in leadership and things like that.
Right.
So we have looked at other firms. We looked at the firm that Santa Rosa's using is a good firm. They're an economic development firm predominantly, but they're a good firm as well. But this firm, I think, has the right price for what we're looking for. I mean, I've heard you all say very clearly about your past experiences with outside consultants, and I've also heard you say very clearly that you did not want to spend a lot of money, that you absolutely do want this money to go to our citizens. And so I think that this firm has been responsive from that perspective.
Yeah, and that's fine, and this is just because of my experience, and Steve, you were here with me, and we took a lot of hits. All I was asking for, as you level those bids, as you compare those companies A to B to C, I mean, there had to be some point of evaluation, Chip. I would just like to have that as a part of the package to justification of this is why we sole source this organization.
Yes, sir.
Because it's their strengths and weaknesses. And so if you looked at other companies, I'd just like to see who else you looked at.
Okay. Janice and I looked at 5 firms, as she mentioned, and we looked at the qualifications, and we based our decision on those qualifications of those 5 firms.
So just bring, tonight, will you just bring those 5 qualifications, and just, how did you get to that selection? Would be of interest to me. Thank you, Mr. Chairman.
Yes, sir. Commissioner Bergosh.
Just a couple of thoughts as I listened to everyone speak. I had the good fortune and the pleasure to speak with a couple of medical doctors on this topic last week, and they both intimated to me that they believe, you know, separating the spin, separating the politics from everything, that this is going to be a protracted, at least 18-month situation that we're going to deal with. So when we talk about an artificial deadline that politicians in Washington, D.C. talked about for expending the money by the end of the year, I think that's not going to happen. That's going to be like chess pieces on a board. It's going to go away. The thing I'm concerned about is what amount of money have we got in the bank? I know that the larger counties got their money, right? So it's going to be a lot less politically palatable to claw that money back from someone who already has it than it would be to say, well, you know, you haven't got it yet. So until we have it in the bank, I'd be very careful about what we're going to spend. As it pertains to a consultant, you guys are right. We had, for that jail, we were told some things, and, you know, obviously, it's going to cost us a lot of money going forward for some of the mistakes that were made there. I mean, extra staffing that we thought that we were going to get, we thought we were going to get technological advances that would lower the number of corrections guards, and to this day, that's what irritates me the most. But I would separate that anger from this. Here, if we make a mistake, it's the kind of thing that comes up in an audit 2 years later. These federal bean counters, and I use that lovingly, Amy Lavoie, they will find any mistakes that we make after the headlines have dissipated a couple years down the line, and then they'll send us a bill for it. So I'm not interested in giving 1 red cent to anyone to tell me how to give a $1,500 break to one of our constituents. We know how to do that. What I'm interested in is what Janice mentioned, and that kind of flew under the radar. We're going to hire someone who navigates these bureaucracies, understands the issues, and tells us how we can use this money without getting that audit finding in 2 years, and more importantly, carries O&M insurance. So if they make the mistake, like the jail guys did, and that we're going to pay for, we will get the money back. So I think that's the intelligent course of action. I think we plan for this to be an 18-month situation, but we push to get the money put into the bank. There is not a chance that after December, they're going to come back and pull that money. They're just not, if we have it. But if we don't have it, there is a chance we would not get it. So that's the distinction that's very important. Thank you, Mr. Chairman.
Thank you. Board, any other discussion? Grover, you're welcome, if you'd like to make some comments, you're welcome to.
So, Steve, and so as we're moving forward, as we do these contracts, we're expecting it to come back to this board as, what's your leadership on this?
So I believe the agreement with integrity is actually the agenda item tonight. That is the agreement with integrity is what's on the agenda tonight.
What about other allocations?
The subrecipient stuff is not, those agreements are not.
That we're not even, this is kind of a preliminary plan of what we're doing, and that will come back.
Yeah.
That's your thought?
And
That is my thought.
And Mr. Chairman, we
Yeah.
could add to the August 10th Committee of the Whole agenda to bring those to y'all, because we were going to try and provide not the 10th, it's the 13th?
I'd probably say next meeting.
Yeah,
Next board meeting for me.
the 20th?
Yes.
Okay.
Yeah, and I mean, I would like some distinction for what we're actually drawing the line as a, you know, a subrecipient versus just somebody that's getting an allocation, because apparently
But I have it pulled up here. When this both from the it's very clear is intended for process when the states and Senate cities were included between with our county happen. Obviously, everything kind of emerging potential that going back to Congress with the potential of personally as a conservative, I think out amongst us percentages can work. I'd be happy if there becomes something that happens from. I'm perfectly happy to push some portion back to county and work. Rather, from our standpoint, between city and county, what we could do from our standpoint, we are arguing nothing more than what we have with state shared sales tax. We're not asking for anything more, anything less. It's 17.332% of the 57,285,000. It's roughly 9.928 million. But what we were sort of looking at is certainly realizing where you are with this distribution. If we could have an even sort of 3.310,000 over the next 3 times that you have that you get funding in, that would therefore come to the city, that would allow us. We have certain. If we're going to do an economic recovery, we may allocate money for economic recovery and use it within your parameters that you're already doing. I mean, certainly we understand being a recipient as well, or even a sub-recipient. We've worked both ways. We certainly have staff that can handle that. We have no problem with that. We do believe somewhere in this that that this money was intended both from Congress and from the governor to be local government, and it was supposed to be cities and counties working together on that. While some cities have chosen to ask Congress for a separate allocation, my feeling is that we should be fiscally conservative and find a way to work together for what we have. We already have, the state has a percentage. I've talked to Janice and Chips. We're not asking for anything out of this first allocation, but if we had something for the next 3 allocations that we knew we're going to get consistent amounts, that's sort of that 9.9 million spread out over 3 different payments, we would be receptive to that. I'd be receptive as well to indicating that if we received a separate allocation, if cities end up getting that we figure out how to bring money back on that same way, and you'd get your 82 point whatever percentage back in whatever we have up to that 9.9 million. So again, I'm more than happy to work with the county. I think it would be better for us to do this going forward. We have some differences that we would see in our mission. It's nothing, again, we've spent about $350,000. We've run out of masks. We would love to go buy some more masks. I know y'all are passing out masks still to citizens. We put out 22,000 masks. That's 40% of the city. We'd love to go buy more masks for our citizens and have those there. But we're like you. We're waiting for funding to be reimbursed for the things we've already spent, so we can go ahead and start spending some of these things back again. So again, that's sort of what we had in mind. But I'm more than happy to work with y'all as we move forward. we understand this first allocation's done. We're not looking to get involved in your first allocation, but we do believe as other allocations come back, and I absolutely agree, Commissioner Bergosh, it's going to be moved. I mean, that's the political reality. The number's going to be moved. We're hearing flexibility in what can be spent in the other three tranches are going to happen. So I think there's a lot of things that will be moving parts, but we would like to figure out a way to solve this with the county going forward. My personal opinion was not to go to Congress for another city allocation, was simply to come to you and try to figure out how we could work together to create something that was responsible, sharing it for both of our districts. If there's a way for us to participate with your funding on economic development, we will work with you on that point. We ought to be able to allocate what we think should go to economic development and then put that into the pot. So we have no problem in working with that. And again, that's sort of where we are. We're more than happy to answer any questions you may have. But I know I reached out to Janice and Chips, and I said, we don't want to disturb anything in this first go-round, but we just would like to reserve some amounts for future, and we can figure out how to do that. We would like to get compensated for our $350,000 that we've already spent, so we can go do some things, and we realize we got to give you the expenses. All that can be taken out of whatever comes back to us, whatever amount we agree to. So from our standpoint, we're not asking for anything more than what we already have in our state shared sales tax. That's what we believe is a fair position for the city to at least have allocation rights over. So again, that's what we're here for, and happy to work with y'all and answer any questions.
Robert, go ahead.
Thank you, Mr. Chairman. I think there's different models that are being done throughout the state. Some are doing it on population, which is probably closer to 16%. Some are just doing it based on anything you want, you just have to come apply for. And I don't think anyone's trying to cut the city out, but I think when we're doing a food program, what does it matter if it's coming from the city or the county? I mean, ultimately, it's still us. We're not asking for proof of corporate or unincorporated parts when they pull up. So, somewhat to my comments earlier was that if you guys have a need for city facilities and things like that, then make those requests. And I'm happy, we're happy to work on you with other things, but instead of just asking for some flat amount that we technically lose all control over once you get it, I'm not really going to support that.
Robert, here's the deal. We handed out 22,000 masks at 3 city sites. One of them, Gull Point. Obviously, if you lived up in Ferry Pass, it was probably quicker for you to go get a mask at Gull Point. We didn't ask for your residency. We simply gave out masks.
Right.
We believe we should be able to give out masks at our sites as well. We shouldn't have to have city residents driving up to a county site to get a mask.
I'm not saying that.
That's all we're asking for.
I know,
Same
I'm
with
not
food
saying that, but if you
distribution.
say we want to give out masks, then we can give you the amount to give out masks.
And we've done the same with food distribution.
Right.
We would do the same with our component that we would be given. We would exactly do the same thing that we've already been doing. We spent $350,000 on dealing with things already in that light. We would continue to do that. And we wouldn't ask. We don't ask whether you're a county resident or a city resident.
I understand that, but as my understanding the conversation was earlier about with the business grants and things like that, do we need to duplicate those efforts, or have you then come in behind and say, okay, yeah, we're going to give our percent of whatever money we get towards this as well? Why can we not just set the amount? And I'm saying if you guys have needs, we can address those, but to have the money come to you first that you then allocate that doesn't, as you say, doesn't necessarily tie to being a city or county resident, then and again, I mean, as we said, it's similar to Restore. I mean, it's the city didn't get a Restore amount, right? I mean, they had to work through us, and you come up with projects, and then we submit it. So how is this any different?
Well, I would say there are two differences in the sense that both Congress and the state, and through the governor's office, both intended for these to be worked through the city through some way. I simply said allocation. I told you on the phone when I talked to you personally, I have no problem if we use your model for economic. I think I have 7 council members that want to figure out what their allocation is. They may not put the exact percentage that you put for economic recovery or human services. I mean, they may, but I got a feeling that they'll have different numbers that they'll come up with. We believe as a city, as a sovereign entity, we have the ability to set those parameters. The money was created by that, and it was clearly communicated by Congress and both the governor that we were supposed to be involved. Unlike school board was not communicated that this money was intended for them. It was intended for local governments. This is the reason that potentially Congress is looking at a separate allocation. I think that would be wasteful. I think we should be able to say, listen, you don't need to allocate any more money for your local government. Cities and counties can work together. They can figure this out. And again, we haven't asked for anything more than what we already do with you on sales tax.
Right, but, and I'm not saying that we cut you guys out. I'm not saying that. I'm just saying that if your council wants to propose something, then propose it and give it to us. But to just send the money over and then say, well, let us know how you spend it, I have concerns with that, because ultimately it's the 5 of us that are responsible.
Well, for one, we're not asking you for anything out of this first tranche other than helping us get the
Well, we have it
350 that we
available for
sent.
you if you want it.
The,
I mean, there's 10% sitting there for other, and again, it's,
And we'll submit our 350,000, absolutely.
Robert, good. Commissioner Underhill and Commissioner Bergosh.
Thank you. Yeah, Commissioner Bender's spot on this. There's really no question that the city has incurred expenses as a result of COVID, and that this money was intended, to help cover down on that. So I would hope that those applications against this money would be forthcoming and not holding out, because I would want you to get that money back so that you can continue to do more. But he's also spot on in basically, Mayor, every single one of your constituents is also a constituent of one of us, as you well know, as from your time here. And the things that we do on this board, we will expend this money in a way that is equally beneficial to everybody in the county. To take a portion of that and hand it over as a set aside for the city would then actually take away from those who don't live in the city, because it's a zero-sum game. So, no, I think that Robert is absolutely, Robert, you're dead on. We will execute, from my perspective, we should execute this precisely as we've been discussing. I don't think I've never seen an example where city residents were punished by not being, because quite frankly, city residents all are going to vote for one of us, so, and certainly, Mayor, during your time on this board, you demonstrated that very well. So, we're on the right path. I think a tranche or an allocation directly over to the city for the city to execute would be inappropriate, and in fact, take away from the non-city residents of the county. Thank you.
Will you be doing food pantries in the city and mass distributions at city locations?
We'll be doing all throughout the county and your cities in the county.
Yeah, I don't want to interject in front of Jeff, but yeah, I mean, I'm not going to necessarily weigh in at length, but the city, I mean, expenditures being within the city limits, I mean, that's, I can't believe that there's any good faith effort that would be made by the board that wouldn't ensure that those things would happen to that appropriate level. I mean, regardless of who's directly dispensing the money or making the vendor payment, ensuring those things happen, because I've got 2 colleagues that have large portions in the city, one that has a small portion, but I know that what happens in the city limits is very important to Commissioner May. I know it's important to Commissioner Bender. So, not having city residents, I would still be very supportive of ensuring that they provide that service to their constituents that are within the city limits. But I'm sorry, Jeff, go ahead.
Yeah, Grover, thanks for coming out today. We appreciate you being here, and I certainly agree with what Commissioner Bender and what Commissioner Underhill said. But I also think this is an opportunity for us to work together and develop programs that we both, the city and the county, can embrace. You mentioned the food pantries, you mentioned mask distribution. There's gonna be no problem with us getting 100% behind that. But I find it interesting that folks talk about, how we ought to be less government, less intrusive, less duplicative, overlapping services, but then the minute a pot of money comes, everyone wants to do, kind of become free agents and do their own thing. I would like to see us cooperate, work together to the maximum extent possible on those things that we completely agree on. Distribution of food, distribution of masks, distribution of hand sanitizer, programs that help folks, through the tough times, maybe with rent assistance. And I don't think it has to have the cities imprimatur or the counties imprimatur. We can work together on it, your staff, our staff. If we give you a lump sum, then if you think about the inefficiencies of that, you're duplicating the effort that we're going to be doing over here. You'll have your staff working on, okay, where's the food distribution going to be? Where are we going to do this? We don't need to do that. I think the citizens want to see us link arms and work together on this. And so that's what I'll be supportive of. It's not going to be a one potato for us, one for you based upon some percentage formula. Because again, as what's been aptly pointed out is that your citizens, every single one of them, are also citizens of the county. So I think there's a more mature way to do it. But again, everyone has said, your $300,000 in expenditures for masks, please submit that money. You will get that forthwith. You will get that right away. Any cost that you've hit, we have the money for that and we're willing to do it. But going forward with programs, these big programs, let's not have two separate teams doing two separate things. Not one portion of my district is within the city limits, but I'm going to support whatever we can do, and that includes helping people in the city, but also people out in Commissioner Barry's district and my district that not one portion touches the city.
Well, again, we certainly would have our staff working those things regardless one way or the other. I mean, those are the things we want to work with. We reached out to Ms. Gilly. We've been trying to work through those things. We simply would love the opportunity to participate also in how this works. But I think that's from our council members. They want to know what they could do. And again, that's what we're trying to figure out how to make happen.
Thank you. I'm sorry. Robert.
If get us the sites that they want something. I mean, we're all in this together. And so if that's what they want, then submit it. We may end up, most likely you would get more than just what you've asked for some of those things. And I think, because I'm going to fight for my residents too. We're 60% of my district, city residents. So of course, I want to make sure that the council members that need a mask or food or something like that in a community center or something in their district can get that, because it's all Escambia County citizens. But on the other hand, I understand that the city has hard costs that they've incurred or going to incur to do that. I think we can work together on the homelessness. That's something that we can all do. And I know that we want to try to put something together, and I appreciate you taking the lead on that. Does that necessarily mean that the homelessness needs to come out of your $10 million? It's something, the $10 million that you asked for. If we have money set aside to combat it, then we're addressing that in the county, and that's what we can work towards. But I've just said, I've said from the beginning to just essentially give you guys the blank check and give you the range to it. I don't know if we can get there, but I am happy to support whatever you all bring forward in asking for funds for projects for the city itself and for the residents.
Well, we have a council meeting next week. We'll be happy to put together a plan of what we expect those things for both food pantries, masks, and other things that we will be doing, and we'll be happy to submit those going forward.
And Grover, from my point of view, for my vote, it doesn't all have to happen, simply through submission, with no communication. I know that you talk, or I perceive that you talked to Robert. I know you talked to Lumen quite a bit. And, if you're welcome to communicate, the council's wishes through them and have it come through, our board, maybe even in a more expedited fashion, where our board, gets feedback and we give direction, kind of downstream from here. Like I said, I know you communicate with those two commission board members. So if I'm going to be supportive as they bring ideas forward that are in the city limits, I'm going to be supportive of both of them. So maybe there's a way to even expedite it. So from my point of view, I mean, you're put in the request. I mean, it doesn't have to just exist in, through a building and a bureaucracy channel. I mean, you can certainly, I would hope that they feel like they can bring those, and you certainly would, bring those to your colleagues on the board and let us push the direction down from here.
We'll be happy to do that.
Thank you. Thank you, Keith, Amy. Thank you for being here. All right, board. As prior to even agenda review has run long, we're probably not going to get extensively into the agenda rather than sitting here until 1:30. I think that there's a very, very, very good chance, due to a number of reasons, that we're going to have a lengthy meeting this afternoon, this evening. That's going to start at 4:30. It's very likely that public forum is going to run into the board meeting time. I would anticipate us breaking at 11:15. So what we can do between now and then would be my point of view, if y'all are not adamantly opposed to that.
That's good.
All right, we'll go into agenda review. Is there, I guess, let me open it up. Rather than Commissioners Forum, is there anything specifically that you want to make sure that we discuss this morning rather than waiting till tonight, Doug?
Nothing that needs to be discussed this morning, but I do have an add-on.
Okay, all right. Jeff?
There's two zoning issues that we'd like to just make some brief comments on, and then obviously we're going to address them this afternoon.
So you just want to make your comments this afternoon then?
Please don't talk about any of the facts of either of those cases, since none of the parties are here. It's advertised for this evening, and they are both quasi-judicial.
Okay, in that case, I'll make my comments tonight then. Never mind, nothing.
Okay.
Okay.
Robert?
I didn't know, Darren, is that, I can't see behind the mask, but, okay. I think Visit might be here for a discussion in some regards. So I just, if we had some time to address that.
Do you want to do that this morning? Okay.
I don't think we have anything on the agenda per se, but I know you guys were here. We do have the TDT collections under the clerk's report.
And I believe that Madam Clerk may have some additional input this morning that we may try to take before that discussion with Visit. Maybe, I don't know if her feedback relates to that or not.
Okay.
And board members, I have an issue with one item on the agenda. It relates to, it's one substantive item on the agenda. It relates to three items actually on the agenda, though. It's public service consent 7 and 8, as well as budget and finance something. I don't have the numbers in 8. I'm sorry, related to the radios.
Yes, sir.
Obviously, it's a very large expenditure, so that's one issue that obviously warrants time, but I don't feel like the way that it's presented on the agenda is indicative of exactly what we're doing and what I'd like to do. The agreements, in my opinion, aren't clear. The way the funding is going to happen is not clear in the agenda. It doesn't lay out that we're not extracting large principal sums from these funds. It doesn't lay out the kind of payment schedule and exactly, if in payment 1, this would be the board's expenditure and this would be our partner's expenditures during that year. So I'd like to bring that back to the next board meeting if there wouldn't be opposition.
I'm sorry, Stephen, please describe that. Which one is that again?
So it's in technical and public service, it's 7 and 8. So those are the agreements.
Are those the radios?
Yes.
Yeah, I thought we're dropping those.
Yeah, I
That,
think you would
and
like
that's what I'm getting at,
Okay,
yeah.
okay.
So I just didn't want to not say anything this morning and get tonight. So ideally, I'd like to drop 7 and 8 out of technical public service consent, as well as the item on the budget and finance related to the radios, and bring it back.
And Steve, I just want to clarify, that's by no means not showing your support for the item. It's just we need to, more clarification before we do it to highlight some things. So,
Yeah.
Of course, we understand that there's the need, and we want to get that done as we can, which we think bringing it to the next meeting would accomplish that.
Yeah, and the board's adopted $4.25 million in LOST4 for the radio purchase. As that is a lump sum. So yeah, the board support is there. That's not my issue. The issue is the way it's laid out in the agenda and the way that the backup, in my opinion, doesn't actually reflect what money is being spent and how that money is composed. Doug?
Thank you, Mr. Chairman. Just want to make sure either Mr. Rogers or County Administrator, there's no timeliness issue with regard to that if this is dropped tonight and brought back at our next regularly scheduled meeting, correct?
We would not be able to go past the next board meeting because of the the September deadline in terms of the, the contract being.
Yes, but if we
yeah.
drop it tonight,
Yes,
pick it
we're
up at the next meeting, that'll give
Yes.
you guys time to staff the thing to the chairman's standard that
Yes,
he's looking
sir.
for.
Yes, sir.
So-
And we do apologize for the oversight in terms of the way that it was, it is not clear, and we understand that.
Yeah, and it's a big purchase, and it should be something that 20 years from now, somebody could look at the documentation and everything makes sense. So Chairman is absolutely right, I think, to drop it and bring it forward as long as there's not a crisis. Mr. Rogers?
Yeah, no, I was just going to reiterate what Madam Administrator said. As long as we get it on the next agenda, we should be fine.
Mr. Chairman, I support dropping the items.
All right. And the 534 public hearing for the E-date for Navy Federal, there was an issue with the advertisement. That needs to be dropped, and it's going to come back on the September 3rd meeting. And Madam Administrator, I didn't get a chance to talk to you this morning. Is there anything else that needs to be dropped that we should articulate or expressly say this morning?
Not that I'm aware of.
Okay, thank you. Madam Attorney, are you aware of anything? No. Madam Clerk, if you'd like to make some comments this morning, you're welcome to. Thank you. Appreciate your patience waiting through 2 hours so far with us before we got to your part.
Good morning, Pam Childers, Clerk and Comptroller. I have several items on the agenda today, but let me talk about first the TDT collection. What I've reported to you is the May returns that we receive in June, so that's in front of you. So that was a 43% decrease from last year. Overall, it's 24% decrease. The numbers you don't have is what was collected in June, reported in July. That's $1,587,703. That's a 17% decrease from last year. Overall, year-to-date, 22%. And Commissioner Bender, I think you recall in our TDC workshop, I told you we're looking at about a 27% decrease overall. I don't expect the July collections to even be as good as June with everything that was canceled. So I still stay on track that it's going to be about 27% decrease. I am in constant contact with Darren, which they'll give their presentation today and know what they're doing, what they're trying to do, and how they're working with us. So the communication is good. It's just unprecedented times, so we're working together. So that's on the agenda for your review. The backups included. The second is recommendation concerning the June investment report. The third is recommendation concerning the intent of the Escambia County Clerk of Court initiate foreclosure against unclaimed monies. And the last is concerning minutes and reports prepared by the clerk to the board's office.
Thank you.
Any questions specifically about TDT or anything else in the backup?
No, ma'am, thank you. I'm going to make it available for Darren to make some comments, and
Perfect.
if you might, like I said, we won't be more than 15 minutes if you might hang
Not a
around for a
problem.
minute. Thank you. Robert?
Darren, as he makes his way up, I would say, of course, those June numbers, what we had heard in that budget workshop was the day that they were due. And so I think you actually probably gained a little over 20% or 30%, 30% that day. So that because we were under $1 million that morning, so to have that 1.5. Yeah, typical. So, morning, Darren. Thanks for coming down and being here. Go ahead and.
Sure. Well, good morning. I actually didn't have prepared comments. I was here in case there was an opportunity or to answer any questions. So I will say that the last TDC workshop was very helpful to understand where the dollars are at and what the county's doing on behalf of their portion of the TDT collections and how that impacts all the organizations and all the line items that receive TDT. On behalf of the unified budget, we have gone through all three agencies, Visit Pensacola, Pensacola Sports, and ACE, and looked at what dollars are encumbered or earmarked for the remainder of this fiscal year. I know all organizations have made some significant cuts, understanding that the TDT collections are down from last year. So in the case of Visit Pensacola, we have submitted our remaining encumbered items, and we have reduced staff. We reduced 3 full-time positions, took another full-time position, made it part-time. I believe Pensacola Sports has also made staff changes. ACE doesn't have staff. But between all three organizations, one of the questions that Pam had was what amount of cash outlay is expected between then and the end of the fiscal year. And we had come up between the three organizations after all the cuts about $410,000. And depending on most recently the announcement that the Summerfest Jazz Festival has been postponed till next year, there was $75,000 or so remaining to be paid out on that commitment. And so that would, depending on how those dollars are designated for rollover or reallocation in next year's budget, that would reduce that cash outlay for this year an additional amount. You know, our focus now as an organization is looking forward. I think we've gone through, you know, that painful process of staff changes and budget cuts that not only addressed what's happening this year, but what is expected to occur next year, being as conservative as possible, not knowing really how things are going to change from month to month. And so with that, you know, our focus, our request as a unified budget is to continue, you know, the priority of investing in tourism and promotion at the level of 65% of the TDT collections. And so, you know, that's what, you know, our message and request is as far as a way of helping, you know, a large amount of businesses and the employees that they pay, bringing us out of the recovery as quickly as possible. We have reached out to Janice Gilley, County Administrator, in regards to trying to utilize CARES funding to provide a marketing message that it promotes the safe and the cleanliness of what's happening in Escambia County as far as visitors. Visitors are coming. We want to make sure that we're messaging correctly, letting them know the best way to enjoy let's say, a Pensacola experience, but doing so in a safe manner. So that's one way that we can augment the loss of marketing dollars that we've had to do for the remainder of this year and what we're looking at for next year.
Mm-hmm. And just to follow up, that does fit in with the public messaging that is one of the categories in the CARES funding.
Sure. And just to give the board a little update, we had a TDC workshop, I think probably about 2 weeks ago now, and we essentially went line item by line item of the current budget and essentially tried to work our way down to what we estimate will be the year's collections. For this board, that meant some of the things that we were expecting, we will not get. So one, we had the 5% set aside that it was wiped out. We had, I think it was a $550,000 reserve set aside that we do not have, that's wiped out. And then I think of discussion or notable for this board is that the 1.3 we had asked to set aside for the Bay Center debt payment, we had used some of those funds for projects, the bridge, for landscaping, and
Beach Access 4 was the other one that.
and Beach Access 4, but it hasn't been spent. And so the remaining portion of those dollars that hadn't been spent, we had to just essentially say we were going to give those up. They aren't there to be collected, and so that's I just want to make the board aware of that, and that we do not have those funds sitting off to the side somewhere. The idea had been that had we had another banner year, and that as things continued to improve, that we were going to replenish that 1.3 with those expenditures, so that we did follow board direction and that it was set aside. But at the end of the day, we just don't have that money to set aside. And so and all the county is giving up about $1.5 million. Like I said, 1 million of that is through reserves in the set aside. Of course, Visit had relied on some of that supplemental budget that we did, and we had cut that by 50% when we made that allocation in March, I believe. And so they had already cut their budget by about 1.4, and then we had to continue to ask them to do it. And I think the ask from them was about 1.5 between the unified budget that we were expecting needed to be cut on top of what they had already cut. So they have had to dig deep to make these cuts. But of course, suspending advertising during April for the most part helped, but still trying to look beyond our current situation and how we can continue to advocate for Pensacola and support a large part of our community. So I think, of course, the CARES dollars can help a lot of those that have been impacted, because we do know that I think tourism is the #1 industry in our area, so that means that the most people have also been impacted by that.
Thank you. Darren, thank you for being here.
Thank you.
All right, Board, if there's not objection, I'm sorry, Doug, go ahead.
Sorry, I realized when I mentioned my add-on, it's not, didn't mean to be coy and not say what it was. There's an issue with regard to the Jackson Street Complete Streets project that we've discussed here on this board before, and I just need the opportunity to speak about it with Lumen in a public forum. I'm not going to be looking for any action on the part of the board today. So.
All right, were there any other add-ons? That's the one part of agenda review I guess I should have done. Robert?
I'm sorry.
Yeah, I mean, if we want to throw the discussion item on about COVID, to have it as a board discussion and not have to have potentially 2 discussions this evening.
I mean, from my point of view, I wouldn't anticipate, I wouldn't anticipate 2 discussions. I wouldn't anticipate 2 board discussions. And it's, for many reasons, I think there's a very good chance we're going to have a lot of people here at public forum. And at least in that setting, I've got some ability to control speaking time. And I still think there's a good chance it's going to push into the board meeting. But unless a couple of y'all, the majority of y'all want to put it on as an agenda item, I just assume maybe leave it as it is. And then if the board wants to take up the discussion later in the agenda, then we can do it.
Well, I think my questioning is if we let the public speak during public forum and then have an item that would allow them to speak on it again.
So, that's why I wouldn't anticipate agendaing an item for it.
Okay.
The board can still take discussion up, but we don't have an agenda item. So, they're welcome to hang around, I suppose, but.
Okay.
Madam Administrator, do you have any add-ons that weren't distributed, or Madam Attorney? Allison?
Yes, sir. There was one for the county attorney's report. It was only an informational item, just informing you of the outcome of the supervisor of elections lawsuit, which we feel as though had a favorable outcome. We represented Mr. Stafford in that lawsuit.
Did we win?
Just informational.
Did we win?
Sort of.
Yeah, it wasn't necessarily a win. There were some concessions made. I think we have to pay some attorney's fees.
It
doesn't sound like we won.
It is, actually.
It was mostly stuff we were already doing. All 67 counties were named in the
Right.
suit. And
as well as the Division of Elections and the governor and so forth, but it's got to do with mail-in ballots, particularly related to COVID, and there'll be more education coming out of the Division of Elections, and that's all the item was. There's no real board action.
but a lot of it was what we were already doing.
Super. All right, Board.